we will be talking about different types of suture knots. Okay, so basically we have three knots. One is surgeon's knot. Okay, surgeon's knot. We have square knot, and we have granny knot. Okay, granny knot. So the armamentarium that is required for suturing is this needle holder. Okay, this is a needle holder. It comes with a ratchet. This is the grasp for our finger, and these are the serrations to hold the needle. Okay, we have a slit here so that it has a proper grip for the needle to be held in a proper position. Next, we have something called Adson's tissue holding forceps. Adson's tissue holding forceps, it comes in two. One is toothed, the other one is non-toothed. The one which we are using here, this is a toothed Adson tissue holding forceps. And the next instrument that is required is a scissor to cut the sutures. Okay, this is the grip with which we can hold up scissor. And the next required is the suture material. We have various resorbable and non-resorbable suture. The one which we are using here is the braided silk suture, non-resorbable. Okay, so this is our simulator. So we'll be grasping the suture. So this is how we have to grab the needle, 1/3 from the eye of the needle, and we will be going perpendicular to the tissues. This is the flap. You can see this is the flap. These are the two edges. These are the two edges of the flap. This is the one. This is the other one. We have to pass our needle through these flap. Okay. So the needle will be passing 90 degrees to the flap. Okay. This is the first bite that we are taking, which is 90 degrees. And it should be according to the curvature of the needle. Okay, now second bite we are taking, which is inside out. Okay, again perpendicular to the tissues, inside out. Now as you can see, we have two ends here. This one is the shorter end, this one is the longer end. Now what we have to do, we have to take the knot. So in a square knot, the first will be a clockwise knot. This is our clockwise direction. You have to take the suture material in a clockwise direction over the needle tip, and then you have to open this and grab this suture, the shorter end of the suture material. Okay, this is how you are going. Okay, this is our first knot, and you can see there is a slippage of the knot. So the second knot in a square knot is the anti-clockwise knot. Okay, this is the anti-clockwise knot. You're going and grabbing the other end. Okay, you're grabbing the other end of the shorter end, and this is how you're securing the knot. And first we saw first there is a small clockwise, and then next one will be the anti-clockwise. The third one will be the clockwise direction. Okay, in a clockwise direction you have to take the other one. Okay, the last bite, as you can see, we have secured the suture. Now with the help of the scissor we will be cutting the suture material. Okay, so this one was our square knot. The second knot that we will be talking about is the surgeon's knot. Okay, so the surgeon's knot, you see, again we will be going perpendicular to the tissues. Okay, I will be taking bite in one go. Okay, keep it, and then in surgeon's knot we will be taking two throws. Okay, we will be taking two throws over the needle, and the shorter end will be grasped, and it will be tied. Okay, Now as you can see in this, there is no slippage of the instrument because the two throws will help in securing the knot. The second knot will be in a anti-clockwise direction. Okay, for proper security of the suture in a to avoid slippage or to avoid the removal of the suture, we'll be taking one more in a clockwise direction. Okay, this is how your surgeon's knot will be. Okay, will be cutting 2 mm. Okay, so as you can see, the sutures, the knots should be on the lateral aspect and it should not come over the suture on the incision line. Okay, so this will hinder with the healing. So the next knot what we have is the granny's knot. Okay, you're holding the needle, we'll cut this. Okay, so the granny's knot, again follow the principles: perpendicular, okay, so in granny's knot the first throw will be in a clockwise direction. Okay, clockwise. Okay, the second knot will be again in a clockwise direction. Okay, in a clockwise direction. The third will be in a anti-clockwise direction and will be cutting the extra suture material.